4 cases of measles have been reported in the Greater Sekhukhune District Municipality. That's in Limpopo. Now, this brings to 7 the number of reported cases in that area. It comes after a reported outbreak of disease in Zimbabwe, where over 700 children are estimated to have died from a measles outbreak there. Now that the disease is within our borders, should we be worried? Well, to answer this and more questions, we're joined by Professor Adrian Puren. He is from the National Institute for Communicable Diseases. He joins us via the virtual platform. Prof, good morning to you. Over 700 children have died since April in Zimbabwe. Are we dealing with a preventable disease or not?
Yes, so certainly measles is a highly preventable disease because there's really an effective vaccine compared to other viruses that you've just seen, COVID-19, where there's a high degree of mutations. The vaccines may have certain effects in terms of preventing transmission and infections to a lesser extent, but mainly hospitalizations, whereas measles really is a highly the measles vaccine is highly effective and prevents transmission and gives virtually lifelong protection. So it's really critical that as we are faced with these particular challenges, which you've just seen in Zimbabwe and other African countries, where the WHO and the Zimbabwean government and other partners are certainly trying to ensure that vaccine coverage is extensive as is possible to really try and stem the large and significant numbers of people that are infected. But as you quite rightly point out, that the additional tragedy is that, in fact, children have died, and you just mentioned the numbers there, which is really tragic. So for South Africa, I just want to comment, is really that we have, I think, about 12 reported laboratory, but now we have, I think, 3 confirmed cases in Mopani. So from the WHO definitions, in fact, those 2 districts already have an outbreak, and therefore it's really critical that the health responses are implemented as effectively and as soon as possible within those particular districts, again, to try and stem the transmission. Measles is a highly transmissible or highly contagious infection, and therefore it's really important that we get our vaccine coverage up to the levels that will really try and prevent transmission. Otherwise, we really will have potentially a significant problem.
Yeah. Professor, if the disease is preventable, why has there been such a rapid spread?
Yeah, essentially because I think if you do not get up, and you've heard the comment about so-called herd immunity. So again, vaccine coverage is really key to the prevention in terms of elimination and ultimately the eradication of this disease, this infection. So in fact, you have to have vaccine coverage up to about 95% for both doses. In other words, in South Africa, for at least, we give our first dose at 6 months because of the immunity gap, and then at 12 months. So it's really critical that we achieve those high levels of vaccine coverage. And unfortunately, I think COVID certainly contributed to the fact that, in fact, even though we were not reaching those high levels, we're certainly getting, I think, to the 85% or thereabouts. This has certainly dropped, I think, significantly down to, I think, 65 or there in terms of our coverage. So that means there's an immunity gap. That means children are susceptible. So if you have circulating measles in this country or importations, not only from Zimbabwe but from other countries, we have a highly susceptible population leading to the types of scenarios that we are currently seeing, for example, in Zimbabwe.
Yeah.
South Africa is not immune to this because, again, our last large outbreak was, I think, in about 2017. And it's essentially because we're not reaching the targeted levels of immune coverage that is important.
Who's to blame, Professor Puren, about children getting this disease and sadly succumbing to it? Is it the parents who perhaps don't believe in vaccinating their children? Because then it means the messaging has got to get through those people first.
So I don't really want to go around in terms of blame, but maybe our strategies. You're quite right. I think there are some challenges that we need to face. We need to ensure that our vaccine coverage gets to those levels that I've said. But how do we tackle that? I think there are probably multiple approaches in terms of providing access. I think it's access to vaccines. Again, we've noted that some parents may have a challenge getting to clinics, for example. Reminders about attending clinics becomes really important. So communications are very important as well. But a new phenomenon, you're quite right, it has been faced in South Africa before, are those individuals who, for religious or political or other reasons, have decided not to vaccinate. And those will create the areas of potential susceptibility. So it really becomes really critical, again, to understand what informs that vaccine hesitancy. I believe even in Zimbabwe, quite influential in terms of how parents will respond to vaccinations. I think there are multiple areas that need to be broached with regard to dealing with vaccine hesitancy, as well as ensuring that children are vaccinated in terms of our approaches to making sure that the vaccine is accessible to those particular parents who may be struggling to get to clinics, for example. So there are multiple reasons, multiple approaches that need to be used.
Yeah. International organizations such as UNICEF and the World Health Organization, they have activated what they say is an emergency response strategy to support the government in Zimbabwe. If international organizations are as worried about the numbers of deaths in such a short space of time, why has this not received attention in the region, Professor? For example, the SADC region. We have not heard the leaders in this region becoming alarmed that over 700 children have died.
Yeah, I think, again, there may be multiple reasons. I'm not always familiar with all of those, but I think COVID-19 has certainly had a profound effect with regard to our approaches to other challenges, other infections such as measles, HIV, TB. There's a whole host of these. And I think there are, you may not see it in public, but I'm hoping that it will become more visible in the public sphere, is really attempts to try and have an integrated approach and not isolate and have these different silos and approaches to the different infections. And again, I think that will become more evident, I hope, in time in terms of our communications from the leadership, from on top, as well as organizations such as ours and WHO and UNICEF, to really try and encourage a more integrated approach to disease surveillance so that we don't end up with the types of scenarios where your coverage of vaccine coverage, for example, declines so precipitously that you have really a large pool of susceptible individuals. I think it's tackling it again in multiple ways. I think that WHO is quite cognizant, quite sensitive to that, and so I'm sure, again, there will be approaches uniting different countries to understand what and how we need to approach this to really try and eradicate, ultimately, this particular disease. Because, as I said, there is an effective vaccine, but we need effective surveillance again in order for us to detect early and intervene early in order to prevent transmission and to avoid the tragedy that we're currently seeing. Because, again, factors such as age, malnutrition, all of these can lead to severe disease and really the poor outcomes, which are really preventable.
Very importantly for us here in South Africa, Professor, you have mentioned the areas Greater Sekhukhune in Limpopo and also another area within Limpopo, Mopane, and you're saying that these are the areas now which seem to have quite a number of cases reported there. The question is, what is the likelihood of a widespread to the rest of the country, and what should the messaging be in our country?
Yes, so as I said, measles is a highly contagious disease. So it's really important, and the Limpopo government, I'm sure, with National Department of Health, have already activated the means of prevention of transmission. So that means looking at those particular districts again, looking where the chains of transmissions are likely to have occurred, and having what we call a ring vaccination. That's the key part around that, an identification of cases, and making sure that individuals around those particular infected individuals are vaccinated. That's really important. But now it's also important to start encouraging parents to, if they are not aware of the vaccination status of their children, to get their children vaccinated.
Oh, that connection to Professor Adrian Puren. Just as we get to the important messaging that the parents have got to be aware of, hopefully we can get him back. I'm told, Professor, you are back. Just take us back to the response. It's very, very key for parents in South Africa to know exactly what to do at a time like this. All right, Professor Puren, I think he's completely gone now. Lost him through that connection, and we do apologize for that, but the messaging is quite clear. You've got to be aware of the vaccination stages of your child. Just make sure you go to your nearest clinic, I suppose would be the message, to make sure that your child's vaccination stages are up to date.